Hi everyone, my name is Gary. I'm a respiratory therapist. I live in California, and if you're new to my channel, welcome. I am so much more active on my Instagram, so please follow me. My Instagram is @GaryRT, and I also have a blog, everythinggary.wordpress.com, where I have a whole bunch of tips, tricks, and all of that good stuff. But in this video, I wanted to do a quick Q&A. You guys have submitted some questions on my Instagram, and I wanted to answer them here. So the first question that I got was, what shoes do you wear to work? So a lot of people actually ask what are the best shoes to wear to work, to wear to clinic, and honestly, it just all depends on you and what you prefer. For example, I kind of need a wider foot. I try and find something that has a really good insole and some like midsole and even like some ankle support. I have tried everything. I've tried New Balance, I've tried Nike, I have tried Adidas, I have tried Adidas Ultra Boost, Skechers. I feel like you just have to switch up your shoes every 6 months. You have to like get new shoes, and even every shift, switching up your shoes a lot really helps. So try and do that, and you won't have a lot of feet pain, I promise. Do you see yourself ever leaving respiratory? Honestly, yes, eventually I think I would, not because I regret it whatsoever. I absolutely am so grateful for respiratory. I think that it has given me a lot, and it's made me like financially stable, and I've just been able to travel, and I've just been really happy with respiratory. I've seen a lot, I've got to do a lot, I've got to help a lot of people, and yeah, I love respiratory. I don't regret it whatsoever, but do I want to do it forever? No, I think, like most jobs, like obviously you don't want to work for the rest of your life. And so I definitely don't want to work for the rest of my life. But anything in healthcare bedside, it is really demanding, like you're on your feet a lot, you're, twisting and bending and pulling and, just dealing with people who are sick. Sometimes they aren't the happiest and they aren't the nicest. And then sometimes you do get the super nice people. So there's definitely like pros and cons, but do I want to do this when I'm like 70? No. I do have other goals in life. And yeah, that's just the honest truth. What are your life goals at the moment? Okay, so very fitting question. Obviously continuing with respiratory, and I'm also pursuing acting right now. I just signed with a new acting agency. Unfortunately, there has been a writers and an actors strike that has been going on for the past couple months, so it's not much work going around right now, but eventually, hopefully, you'll start seeing me on your TVs soon. So that would be a really good out. I wouldn't be doing respiratory if I became a successful actor. So how did you get through mechanical ventilation? Mechanical ventilation seems so big and so scary and so confusing at first, which is totally understandable because it is, and it's such a beast. But you really just have to kind of like break it down when you're studying. Try not to focus too much on, like, you really just have to try and focus on like understanding the overall concept, and then go into the like details of everything, because if you try to understand each little detail at first, it can be really confusing, like with like triggers and the different modes and sensitivity, and like trying to understand every little thing. Just try and understand the general concept first. And yeah, and there's some really good videos out there. I actually did a video on volume control ventilation on my Instagram. So if you go to my Instagram and if you click subscribe, I have a whole different section where I educate people on different topics. And one of the topics I talk about is volume control ventilation. So definitely check it out, and check out my blog too. How long did it take for you to get your associates in respiratory care? So like any other associate's degree, it takes 2 years. The program is 2 years, so it depends how long it's going to take you personally to get through all of your prerequisites. People work, not everyone is a full-time student, and so however long it takes you to get through those, then you can apply for the respiratory program, and once you get through that, then you apply for the boards and you take your board tests, and we have 2 exams that you have to take to pass to get your license. TMC tips. I have a whole video on the TMC. Check out, on my YouTube here, and you could even go to my blog, and I have a whole blog post about the TMC, what I did to study, and how I passed. I just graduated and I'm applying to jobs. What should I expect from a job interview? Really good question. If you do a deep dive on my Instagram, I actually have an interview tips video and what it was like going through my interview and how I passed. And I highly recommend that because I did that video right after I took my interview, and it's just really fresh. But when it comes to interviews, every interview is going to be different. Sometimes you will interview with the main director of the respiratory program. Sometimes it will be with just another RT. Sometimes it's with a panel of people. I've done interviews where it was with a clinical educator and the director. I've done interviews where it was a supervisor and just another RT. And I've done interviews where it was the manager of the cardiopulmonary department. So it just all depends on the hospital. Generally, they just want to meet you. They want to know more about you. So, just have a little spiel of who you are, and, because they're going to say, like, so tell me about you. Why do you want to do respiratory? And just sell yourself. Tell them, you're this type of person, you're very compassionate, you're very determined, you're a quick thinker, you're a quick learner, you just really care for people, and tell them about your whole schooling experience. I went to this school, I did 300 clinical hours at these hospitals, and I just really learned a lot, and blah, 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 and all of that. And they might ask you a couple clinical questions. They might show you like an ABG and say, what is this? It's usually respiratory acidosis. And they might ask you like, okay, what would you do? And then they might also, I had like situational questions, like, tell me about a time when somebody lied to you, like those kind of like awkward questions. But yeah, just be yourself and be fun and be outgoing and be friendly, and, say, that's a really good question. Let me think about that one. And, try not to lie or like make something up, because then you're going to fumble. And, you could even tell them, I don't know that right now, but I would love to learn what that answer is and how I can do better. And, how can I be a good RT in this department? And make sure you ask questions too, because they really like that. It shows that you're engaged. But yeah, stuff like that. What are things to look for as a new grad applying to my first job? Most places when you're a new grad, they really are there for you. You're going to go through like a training period where either an RT is following you or showing you around. It might be a couple weeks, it might be for a couple months, just depends on the facility and the type of hospital and how many ICUs you have and all the things that you need to learn. But yeah, just expect to not know what you're doing, and that's totally okay. Everything is fresh and new for you. Please ask questions. I think your biggest deficit is going to be time management and managing a full workload of patients in a new hospital, and getting the groove of everything and trying to earn that respect from the nurses. And but eventually everyone is going to know who you are, and they're going to remember your name, and just be confident with your skills. Like, you did pass the RT program, you did pass your boards, you do have your license, and you did get hired. So remember to have that confidence. But also, if you don't know something, totally ask, and it's totally fine. And, for the first couple weeks, you might be like, I don't know if I can do this, because I definitely went through that, but you definitely can do it. And trust me, it does get so much better. So just stay strong, ask questions, and you will be just fine. Are all the nurses that you work with regretting going into nursing? So I guess this might be a question from like a nursing student or something. A lot of nurses, they do say it's hard. They do have a lot of loans. I think, some people definitely say like, oh, I wish I knew about this career or that career. I think that nursing is so well known that a lot of people kind of just jump to it, but it really is a lot of work in terms of schooling and actual work. Do some people regret it? Sure, but some people regret a lot of different jobs. But a lot of people also, it might be hard, but it doesn't mean that they don't like what they're doing. And I think with nursing, it's so great too, because there's so many different avenues that you can go into. You can, do outpatient care. You can, work at like an aesthetics clinic. Whereas with respiratory, you're kind of mainly stuck in the hospital. And yeah. And so another question that I get often is, how much do you get paid as a respiratory therapist? I get this so much, but it's such a big range. Like, there is no way for me to say you're gonna get this, because it all depends. If you look at the average of how much an RT gets paid in Los Angeles, I get paid over that average. If you look at like the top percent, a lot of us get paid over that top percent. And in LA alone, I have worked at hospitals where it's like $28 an hour, and there's hospitals where it's like $65 an hour, and there's hospitals where it's $45 an hour. There's hospitals where you get paid time and a half after 8 hours. There's hospitals where you don't. It just really, really depends. It depends on your experience. It depends if you're part-time, full-time, per diem. It's such a range. There's no way to tell you how much you can get paid. And it all depends where you live. But yeah, I think that the pay is generally pretty competitive. It's pretty good. Obviously, if you're in a small town in a small state, or even a small town in a big state, you're gonna get paid less. So it just all depends. And yeah, but I think it's really good for minimum just having like a 2-year degree, but yeah. Someone said, if you weren't doing respiratory, what would you be doing? I kind of answered this. I mean, I would be like acting or in the film industry or something like that. I used to love video production, TV production, and editing. Is the respiratory program hard? The RT program, it's hard looking back at it. It's hard to say that it's hard because I've passed, right? There are definitely moments where I was in the program where I was like, oh my gosh, like, I need to pass this class. Like, I hope I can pass. Like, this is getting hard, but you really just have to not get into that mentality of, I don't know if I can do this, and like lacking that confidence, because I've actually had classmates and friends who got so into their head and they were studying so much, but they were just so like in their head and doubting themselves and not studying properly and not changing their studying method, and just so overwhelmed with passing the overall program. And you really just can't do that to yourself. You have to focus on that class, and you have to focus in the moment and study like what you need to study, and just forget about the future. Forget about like starting clinicals, forget about starting your new rotation, forget about passing the overall program, forget about like passing your boards. Focus on the next thing at hand. Focus on passing the next quiz. Focus on passing the next exam. Focus on making that study guide. You have to be in the now and don't get in your head, because as easy as, like passing a class can be, it can also be really hard if you make it extra hard. It's obviously not the easiest thing in the world, but it's also not the hardest thing in the world. There's so many people who pass and who work in the field that honestly, sometimes you're like, how did you even get your license? Like, whether it's a nurse or an RT or whatever. But people pass, okay? And, English does not have to be your first language. Don't let that hold you back. You do not have to be the brightest bulb. Like, I was not an honors student. I did not take, like, the highest level of math in high school or anything like that. Like, that was not me. I was not a science major. I came from video, TV production, acting, theater, and I did it. You can totally do it. Just have faith in yourself. Okay, I feel like this video is getting a little long. I've answered most of the common questions. The rest are kind of just like random silly questions. But thank you guys so much for watching. I hope you learned a little more about respiratory, or I hope some of these questions answered a question that you may have had, and I hope you just remember to have that confidence to pass the class. You can totally do this, and you should do respiratory. Respiratory is a lot of fun. You are all around the hospital. It's very different and engaging, and it's very specialized. You feel really good about yourself. Every day is different. It never gets boring. And yeah, I hope that you guys are doing all right. And thanks for watching this video.